MACRA, the real changes coming to Medicare in 2020. My name is Robert Bache, MedicareBob, and I'm going to go over the changes that are coming to Medicare in 2020. First, what is MACRA? It stands for Medicare Access and Chip Re-Authorization Act of 2015. It's fancy. MACRA has many components, one of which is a limit on first dollar coverage in certain Medicare supplement insurance plans for individuals considered newly eligible, and a transition away from using Social Security numbers as identifiers. For the purpose of this law, newly eligible is defined as anyone who is turning 65 on or after January 1st, 2020. So, what does this really mean to you? This means that the government is going to issue new Medicare cards. Medicare is going to start distributing these new cards in April of 2018 with the goal to have this completed by April of 2019. This also means that anyone that turns 65 after January 1st, 2020 will no longer be able to purchase first dollar coverage Medicare supplement plans, which is Plan F and Plan C. So the new Medicare card. Here's the big change, which is fantastic. Your Medicare card is no longer going to include your Social Security number. Most of you, if you look at your Medicare, the red, white, and blue card, you're going to notice that your Medicare claim number for most of you is your Social Security number with a letter afterwards. Here's the good news. That is no longer going to be the case. You're going to receive new Medicare cards in April of this year, and the goal is to have it finished by April of 2019, and you're going to get a new Medicare number. It's not going to be your social, it's going to be a randomly generated number. Now, don't panic. Medicare is anticipating a transition period, so your current Medicare card will work, I would say, at least for the next couple of years. Now, as far as the first dollar coverage, does this mean Plan F is going away? Great question. There is a lot of misinformation about this online. A lot of agents are telling people incorrect information. So here's the real facts about what's going to happen to Plan F moving forward. If you turn 65 before January 1st, 2020, you have your Plan F, you can keep it. You're grandfathered in, it's not going to go anywhere. If you wanted to, you could keep Plan F. The carrier is going to be required to offer this plan moving forward, so again, you can keep it. You're grandfathered in, you can keep it. However, if you turn 65 after January 1st, 2020, you will no longer have the access to Plan F, so you'll not be able to get it. You'll have to get a Plan G or Plan N or one of the other really good supplement plans. So, if I have Plan F, should I keep it? Great question, and I'm going to give you some reasons for why I would say no. Okay? The first reason is this. Plan F is the guaranteed issue plan. That means that carriers have to accept people that are not at a certain health level without medically qualifying into the Plan F. This causes higher claims, which causes the carriers to increase the premiums for the Plan F. So even though you have Plan F and you can keep it, if you're healthy enough, I would recommend getting out of it and going to a Plan G. Another reason why I would not recommend keeping Plan F is over the past few years, we've seen the Medicare Part B deductible increase from $147 to $183, so about $36 for the year. Doesn't sound like a lot. However, look at it from the carrier's perspective. If you have 1 million people on Plan F and the Part B deductible increases by $36, that means it is costing you, the carrier, $36 million more per year to insure your Plan F clients. What are the carriers going to do? We've already seen it. We're seeing higher increases on Plan F. If you look over the past few years, Plan F has had higher increases than Plan G because I believe the carriers are already anticipating this. Another issue is no one that turns 65, whole point of this MACRA law, will be able to get it. Well, what does that mean for you? Well, the whole idea behind insurance is everybody pays a little so no one has to pay a lot. Well, if there's no new 65-year-olds joining the plan, the only people that are going to be on Plan F are the people that are most likely too sick to leave or they don't know they should go to a different plan. So you're going to have higher claims. It's going to be an aging block of business. Think about this. By 2025, the youngest person on a Plan F is going to be 70 years old. Okay? So again, the carriers, I believe, already are seeing this. And I can show you, and if you look at our Facebook page, I already posted it. Most carriers are increasing the Plan F at a faster rate than the Plan G. So, what do I recommend? Medicare Supplement Plan G is what I recommend. A few reasons. Plan G offers a greater value than F right now. It's easy math. For most people, they're paying $700 more for a Plan F than they get a Plan G. And the only benefit difference is G requires the person to pay a very small $183 deductible. So why would you pay an insurance company $700 so they could pay your $183 benefit? That doesn't make sense to me. I would say keep the money in your pocket, pay for the G, and pay your own Part B deductible and save the $700 in annual premium. Kind of already touched base on this. Again, since the MACRA was announced in 2015, this law that we're talking about, the carriers, I believe, have anticipated that the Plan F's premiums are going to be an aging block because nobody new will be able to join a Plan F. And so we've already seen the premiums starting to increase more on F than G. And I think past 2020, that is going to be a big difference. I think we're going to see the F increase quite a bit more, and G is going to continue to offer a greater value, much more than just that $700 that you could save now. Facts about all Medicare supplement plans. I get this question a lot on Facebook, and I basically copy and paste the same answer. Bob, why are you telling me this now? It's not October. I can't make a change regardless. That's just not true. Most people do not know this, but you are allowed to shop your Medicare supplement plan all year long. The October 15th, December 7th annual election period only applies to Part D drug plans and Medicare Advantage plans. So if you have a Plan F now and you want to go to a G, you are allowed to shop your plan. If you have a G or an F and you can switch your plan. As long as you're medically eligible, you can switch your plan all year long. Now, the pricing for Medicare supplements are based on your zip code, your gender, and your age. So that's why we can't just post the same price for everyone, okay? So you want to get a quote, but it's going to be based on your zip code, age, and gender. Also, if your doctor accepts your current supplement, they will accept any supplement plan. With a supplement plan, Medicare is your primary. So you can go to any doctor, any hospital that accepts Medicare. So if you're thinking, well, I have the Plan F with such and such carrier, and I know my doctor takes it, so I may not want to change because I don't want to, upset the apple cart or anything. It makes no difference to your doctor. Medicare is going to get billed as your primary. Your supplement's going to pay the doctor exactly the same. Okay, so it makes no difference to them who your supplement's with. Unless you're new to Medicare, you must qualify for Medicare supplement plan. This is another question I get. Well, Bob, didn't Obamacare say that I'm automatically approved for any plan I want all the time? No, unfortunately, that's not the case. With Medicare, when you first are new to Medicare, so you first turn 65 and get your Part B, that's the only time in your life you're automatically approved for any plan you want. So if you're healthy enough now and you have an F, and you agree that the Plan G is a better value, you'll save money now, get more rate stability. If you're healthy enough to do so, you need to switch now. If you wait thinking, oh, I'll just wait till 2020 and see what happens, the problem is you may not be healthy enough at that point to change, and you might get stuck in that higher rate class with Plan F. So if you've had stable health history over the last couple of years, give us a call. Let's see how much a Plan G would save you, and let's see if you're Medicare eligible for it. Another fact about supplements, if you've had the same plan for 2 years, you're overpaying. It's just like homeowners insurance, car insurance, any insurance you've ever had. Most of the time, if you have the same plan for 2 or 3 years and you haven't shopped it, you're paying too much. Okay? These carriers are competitive. They come out with new rates all the time. They want to earn your business. But if you don't know to look and you just keep the same plan every year, you're overpaying. How my office, MedicareBob's office, can help. Senior Healthcare Direct, my office, represents all the top Medicare supplement carriers. So we help our clients get the best value for the supplement. Give us your gender, age, or zip code. We have a quoting tool. Put it in. We look at every single carrier, and we're going to get you the best price with an A+ rated carrier. Now, once you're a client with us, we do all the work for you. Every year, we do annual Medicare supplement reviews. So you get a rate increase with such and such carrier. We're going to contact you and say, hey, it looks like your price is going up $8. Do you want to take a look to see if you can get the same plan for less money? We also do Part D drug reviews. We're one of the only Medicare supplement brokerages that are also all AHIP certified to help you with your drug plan. So every year in October, you never have to wonder if you have the most cost-effective drug plan because we'll help you with that every single year. Credibility. A+ rated with the Better Business Bureau. Over 25,000 likes on Facebook and over 12,000 happy clients. So if you're looking for a good broker to work with, I'm going to keep you educated, get you the best value, help you with your supplement, your drug plan every year. To summarize the changes that are coming in 2020, you're going to get new Medicare cards that will not have your social on it. That's going to start in April of 2018, and it's going to go to April of 2019. Hopefully, that's their goal to have it done. And then also, Plan F is going to not be sold to anyone who turns 65 after January 1st, 2020. If you have it, you're grandfathered in, you can keep it. However, I anticipate higher rate increases on Plan F. So if you're medically eligible, go with the Plan G, pay your own $183 deductible, and save over $700 in annual premium.